I get a lot of questions about how to use insurance, how to use in-network insurance versus the difference between out-of-network insurance, and I'm here to explain as much as possible to you in a short period of time the complexity of insurance. My name is Huang. I'm an occupational therapist and certified hand therapist, and I own and run hands-on therapy services as well as I teach online through Hand Therapy Secrets. So when it comes to insurances, you essentially, as a customer, like you're a customer, I'm a customer, I'm a human being, you're a human being, and at some point in our lives, we might need therapy services. Now, therapy services is a type of healthcare service. We are a type of healthcare provider. Like, so if you're dying, right, you have a heart attack, you broke something and you need that repaired so that you can live, you're going to go to a hospital, you're going to go to doctors, they're going to fix you, right? They help to keep you alive and survive. Therapy services, usually you come to us when you have aches and pains. There's something that you can't do. Like most people come to us because they had surgery or they can't sleep and they can't do certain things they want to do. So therapy services helps you to live your life now that somebody like the doctors have helped you to stay alive, right? So I just wanted to bring up that nuances because it's important when you are considering what's important to you. We have, in terms of insurances, there's so many different types of insurance and like healthcare insurance, and there's different plans. So even if you hear big names like Blue Cross and Blue Shields, Cigna, Aetna, Humana, all those are like these huge mega billion-dollar companies. And then there's little itty bitty insurances as well, smaller companies that break off that kind of actually belong to these bigger companies. And these big companies became really big because we as a consumer, we said we want to pay this so that they can help negotiate our rates when we need to go to the doctor, if we have an emergency. Like for example, what if you get in a car accident, you need life-saving services, then thank God that you have insurance, right? So that it can cover majority of your medical bills and costs and you won't lose like your home and livelihood. So what we've done is when we buy into insurance company policies, like myself, I've purchased into it, we buy into a particular plan that says, okay, you can utilize these services and they're included in the price that you pay. But now here are sometimes you have to pay co-pays, co-insurance, all those things. And that's your responsibility. So we have a responsibility as a customer, me, I not only pay my premium, but then it's my responsibility to also pay these other fees that come to utilizing certain types of services. So I can, as a consumer, utilize these insurance types of things in network, right? So the big companies determine where you can go, right? These big companies determine where you can go and how much you pay. That's in network. When you decide maybe you can't find what you're looking for in network, then you might consider going out of network because you value having the choice of who to go to, where to go, and the type and level of service that you're looking for. And then you might consider going out of network. And so those are pretty much the really two big concepts. In network is you do exactly what the big insurance companies tell you to do. So in terms of therapy services, sometimes these big companies decide they don't want to work with small private companies like myself. I own hands-on therapy services. I've owned it for over 10 years now, and we provide a certain level of service for people who value how to do business with us. They value the fact that we can give them time and attention. If you call my office, you will be met with somebody who is willing to talk to you, who wants to talk to you. We are going to ask you questions to ensure that we can help you before we even set up a paid session, right? If we cannot help you for the things that you're looking for, then we want to be able to at least guide you in terms of the right places. Now, we are considered an out-of-network provider, so these big insurance companies decided they don't want to work with small companies like us because of how we want to provide our services. And so we are out of network. So one of the things that we'll do is we'll find out if you're willing to at least talk to us and you want to know more about how we provide our services that might be different from other people. Then we can check your in-network, we can check your out-of-network, and then we'll tell you right away what you're responsible for, and how you could work with us. If you are only looking for an in-network, you're like, Huang, I don't want to hear it. I only want to go to wherever my insurance company tells me to go, then you might feel like you're limited in your options, right? But that's because you are. The insurance company is going to tell you exactly where you are allowed to go, that they will cover. And they'll tell you how much they'll cover. So sometimes you're still going to pay out of pocket. You're just going to pay maybe a lesser amount, but you also might be receiving services maybe not up to the par that you're looking for. So it is really a decision that you have to make, and we as a company, we want to help you make those decisions. Like, we just want to be able to provide you with information that can help you determine what is right for you and what you need at the time you need it. Myself personally, I do have health insurance and I have such a huge in-network deductible, right? An in-network deductible means, like, let's say for example, for real, my deductible is $6,000. So no matter where I go, I am coming out of my pocket $6,000 before the insurance company will pay for anything. In order for that to happen, and it has happened before, we had to be hospitalized because the normal everyday visits to the doctor, to receive different types of therapy services for anyone, and myself and my family, may never surpass that amount. So find out what your deductible is, what your in-network and out-of-network is. It can be quite a complex a situation and question, but if you are looking for therapy services, right, and you are truly interested and you are committed to finding the help that you need to get rid of your pain, to be able to get back to work, to be able to work so that you can make money for your family, so you can provide for your family, so you don't have to take sick days off and consider having injections and surgeries where that will require even more therapy. So sometimes what seems really expensive on the front end is actually going to save you time and money, versus whatever sometimes you're going in network and you're not getting what you need when you need it, and it can drag itself out and in the end could cost you even more money because of how much time is wasted and how much copay is wasted going to places that may not serve you in the way that you need. So if you have questions in terms of in-network and out-of-network and how we here at Hands-On Therapy Services can help you get rid of your aches and pains so that you can avoid having injections, so you can avoid having to take pills day in and day out for your pain, if you are trying to avoid surgery, if you have had surgery and you want the best possible results so you don't have to go for a secondary surgery, we can help you. Give us a call here at Hands-On Therapy Services, and one of my specialists will help you figure it out because it can be complex.